Okay, so if we just start off and we just look at the basic anatomy, this is a nice image here to show this. So if you look at the screen, you start at the very, very top. There's just a thin white line. That's the skin. That's the top of the skin. And then there's a little bit of a whiter gray kind of thing. That's the dermis. So we can actually see the top of the skin, the epidermis, then we see the dermis. And then if you look a little bit lower, you see that gray area there, and that's fat. Fat is in that black gray color. But so the fat is a little bit blacker, it's a little bit darker than the dermis. And then you see that white line kind of coming across. That's, and it's not totally complete, that's fascia. So fascia is throughout our body. That's really what gives everything strength and holds everything together. And then you can see it's live. You see it's moving here as I move my hand. And then there's kind of multiple fascial lines that are going in there, because the fascia is almost like a spider web in this area, and it's got little attachments that go throughout. So then we're going down through that, and there's a measurement here. So we can see that distance there is about 3 centimeters, which is a little bit more than an inch. And then we get down to the muscle. So at the very bottom here, you see how it changes texture? You see how there's a fairly white line. It looks like a little bit thicker, and then the pattern is more the horizontal. Those are the striations of the muscle fiber. So this really breaks it down into these components where we see the skin, we see the fat, and then we see the muscle. So that's why using ultrasound is very safe, because we can see what we're doing. When I used to do BBLs, started a long time ago, or more than 10 years, 15 years ago, I guess, everything was blind. We couldn't see anything. Now, I know that sounds kind of terrible, but as surgeons, we do things sometimes blindly using landmarks on the outside of the skin, and then we can feel through the cannula. And so it was, not the only procedure that we've ever done blind, but it's better to be able to see. And so we used to do things that have to go by more of how we felt. Now, I've never had a fat emboli, I've never had a problem, but just because I was being very cautious not to go too deep. But now with the ultrasound, we can actually see everything, so it's much safer. We see where the fat goes. But it's also much better from a cosmetic point of view, because I can be more precise where I put the fat, and I can put it into areas that will distend better, so we get more projection. So I'm just going to show you kind of where I'm going to put this fat. So here's my fat here in the syringe, and it's connected to a cannula, which is just a metal tube. And I'm going to just bring my cannula over here to where my ultrasound is. And I'm not injecting fat here, I'm just moving my cannula. So here we see the cannula. So it's traversing across, it's diagonal. And I'm going to move it a little bit. You see how it's moving that tissue down? And then the very white part is the tip. And so that is just a little bit too high for me where I want to inject. So I know I'm well above the muscle, but I'm a little bit too high. So I actually want to come down. I'm going to bring this back, and then I'm going to bring it back into the picture. And it takes a little bit of force because you have to go through some of this fascia. And so now we're in a better place. So here we are. Let me just bring that into focus. So there it is again. So now I'm not so high. I'm in this nice area, but you see I'm clearly above the muscle. So now if you look at the screen, I'm going to inject some fat now. Here we go. See it coming out? And it's rising up on the ultrasound, and it feels soft on my other hand as I'm injecting it. So you get like sort of this double feedback, and then I can see. So that's why I'm just such a huge fan of the ultrasound, because it allows me to be a better BBL surgeon by being able to see these things, because I can get more expansion by very detailed, we're talking millimeters, less than half a centimeter, 2, 3, 4 millimeters of precision now that we can get with the ultrasound. And so I can go into areas that didn't have fat placed in them and put a little bit more fat in there so I can get a little bit more expansion. And so that's why I say we've kind of moved past ultrasound just as a technique for safety, but now it's really a technique for getting a much better cosmetic result.